Let's just have a little look at how modern technology can help you now and in the future. We no longer have to take molds of your teeth. We've got cameras that go in your mouth, which we call scanners. And if you've had an invisible brace, then this is what you would have had. And if you hadn't, it's almost certain that the lab would have actually scanned the model of your teeth and made your aligners on something like this. So instead of a JPEG file, as on your mobile phone camera, it takes what's called an STL file, and you can make a variety of things from these files. So from this basic STL file, you can make night guards for people that grind their teeth of a night. You can make gum shields, which are essential if you do a sport such as rugby or boxing, and also clear aligners that in some cases can be used instead of the fixed braces to move teeth around. And obviously at the end you get a retainer, and you should always hang on to your retainers and have an STL file for them, because if you lose the retainer, then you can easily send off and get one made on one of these 3D printers. Again, these STL files can be used to make bleaching trays. Lots of people want to have their teeth whitened, and quite frankly, the toothpaste just don't do it. And there are instructions on how to have your teeth whitened in the hygiene therapy section of the app. And your own dentist and possibly even yourself will have 3D printers at the practice and will be able to replace your worn out retainers immediately and send them to you either at home or at university or when you're on your gap year. And in about 70 years' time, when you're a bit frail and unable to use your arthritic hands, then these may help the carer who's looking after you. The sad thing is we have the technology now, and it's a measure of society and how we choose to look after all of those who are more vulnerable.